Attendees are in listen-only mode.
Thank you for joining the 2016 Health and Physical Education Assessment webinar. This webinar is going to go over information about the 2016 assessment. First, we'll go over an introduction of the assessment, talk about its administration, the secure file transfer protocol, the assessment platform, and let you know how you can go about asking any questions. So first of all, as most of you may already know, the Health and Physical Education Assessment has been created as a way to fulfill the District of Columbia's requirement with the Healthy Schools Act of 2010. So this act requires OSSI to collect and report student performance on DC health and physical education standards. As a result, we have created this assessment and we test students annually in 5th grade, 8th grade, and high school. High school students are tested during the year in which the health class is provided, and they're tested on their health and physical education knowledge in relation to the standards. The 2016 assessment has the options of for the 2016 assessment, we have provided LEAs with the option to either administer their own assessment, and they could do this by creating any plans or using plans that they already have established in the school to assess the already in place health education standards and physical education standards. For those LEAs that did not wish to create their own plan, then OSSI generated an assessment, and this assessment has been aligned to the proposed standards to be implemented in the 2016-2017 school year. And this was a way for LEAs to be able to field test the standards and be able to provide feedback on the standards before they were implemented. So this was the two options that we gave LEAs this year to provide them with a little bit more flexibility and give them a little bit more autonomy. For the assessment, we will have a long window of March 28th through June 10th, and LEAs will decide when they want to administer the assessment within this window. We are not telling you have to administer it in particular weeks. We really want the LEAs to have some flexibility. By March 25th, we have asked that you notify us of your intended assessment start and end date by communicating this to ossi.schoolhealth@dc.gov, just to give us, again, a better idea of when LEAs will be administering the assessment. Now, we have also asked that each LEA designate a health assessment coordinator, and this is just to facilitate communications that go from OSSI to LEAs, and any questions that the LEA might have will also be able to be communicated easier. So as far as the responsibilities of this coordinator, we again would like the coordinator to be in constant communication with OSSI to bring up any concerns that the LEA might have. By March 25th, again, we asked that you notify us of your intended assessment start and end date. By March 25th, we also granted access to this health assessment coordinator to the Secure File Transfer Protocol subfolder. So as you know, a subfolder titled Health and Physical Education Assessment was created in your LEA's SFTP site. And this is where we will upload any information to make sure that it is kept secure, it is transferred securely to and from OSSI. The health assessment coordinator should then download the student assessment IDs from the SFTP site. These were also uploaded, and if you have any questions about it, please feel free to reach out to us. But these should be in your assessment folder. Now, once you have downloaded them, then we would like you to distribute them to the health assessment proctors in the schools. By March 29th, we're asking that you simply notify us if your LEA will require any paper and pencil versions of the assessment and for what grades through ossi.schoolhealth@dc.gov, and there'll be more information following up about this paper and pencil versions. This is for students with accommodations. April 29th, we want you to let us know which high school students, if any, will be taking the assessment, also through the SFTP site. And again, this is just for high school students, so if your LEA does not have high school students, you do not have to complete this requirement. By April 29th, we would also like for you to inform us of any students who may require accommodations for the assessment. And aside from the paper and pencil version, which will be provided in a soft copy through the SFTP for LEAs to download, all other accommodations for the assessment will be up to the LEA. Now, the health assessment proctor will be the person that we recommend be in charge of everything at the school level. So that's everything from administering the assessment, receiving and tracking any materials that are provided by the health assessment coordinator. We have a proctor script guideline which we have developed that you can use before, during, and after the administration of the assessment. So it just kind of outlines the process before, during, and after. Now, as I already mentioned, we will be doing all of our file transfer to the Secure File Transfer Protocol, referred to as an SFTP. And this is basically just a safe way for OSSI to be able to transfer any information to the LEA and for LEAs to be able to upload any information that they're sending to OSSI. So anything that contains any insecure information, we would like to do it there to maintain our students' confidentiality. Now, access will only be granted to one person in the LEA, and that will be the Health Assessment Coordinator. So as I already mentioned, access was granted on Friday. Now, these are some of the examples of the data that will be uploaded by OSSI and uploaded by the LEAs. So for example, OSSI already uploaded the assessment IDs. They will upload a paper and pencil version of the assessment for any LEA that may require it. The LEAs will upload high school rosters, if applicable, and any notifications of student accommodations. Now, once the Health Assessment Coordinator has been granted access, they will be receiving an email that looks just like this. So they'll have their name, the username, a password. This password cannot be changed, so this is the password that you will continue to use. It will tell you your LEA's name, the folder name, and then it will tell you that you have been granted access to the subfolder titled Health and Physical Education Assessment. You do have the website on how to access where to go to access the site, and if you have any questions, there is an email that you can contact. Now, once you have accessed that SFTP site, you will come across these folders, and then you will see your LEA's name. You can click on the LEA's name. You will be routed to the various subfolders. So we have created this example for you to be able to see the subfolders, but then again, you will have many subfolders. So you have to click on the Health and Physical Education Assessment subfolder. Now, if you're ready to upload a file, you would just click on Choose File, search it on your computer, and just hit Upload. And that will be the way that you will be uploading any files that you want to transfer to OSSI. Downloading a file, then once you're in your subfolder, you would see any files that may have been uploaded by OSSI. All you have to do is click on the file. Now I'm going to give you an example here. As you know, we will be uploading, or we have uploaded, the assessment IDs for the students. So over here you would see assessment IDs, you will see the LEA name. Once you click on that, you're going to get this pop-up in the bottom that says, do you want to open or save this file? You want to hit open at the bottom. Now you're going to get these files. So you have a file that has all of your schools and a file that has the LEA. So the bottom file that you see, the Excel file, this will be the LEA's master file. And this, when you open it up, you will see various subfolders for each school, and this is just for the LEA. Now the other one, once you open the zip file, so you click on that, and you will have the various schools. So as you can see here, you can easily grab one Excel and distribute to school A, school B, school C, and so on. Now, this is what the Excel file will look like. So this is a sample. You'll have your LEA code, school code, the student grade, any testing student IDs, student LEA name, school name, and then the student's last name, first name, the middle name, and then the date of birth. So again, you'll have a separate file for each school and a master file for the LEA. Now, once you're ready to administer the assessment during your timeline, you will be accessing the platform. Now, this has been created on SurveyGizmo. We have released the link also through the SFTP site. Prior to the assessment administration day, we encourage you to test it on your computers. So just make sure that you're able to access the site. And again, it has been created through SurveyGizmo. For those of you not familiar with SurveyGizmo, it's a platform that is very similar to SurveyMonkey. So it's a surveying tool which should be very straightforward and easy to use. Once you have gathered your student assessment IDs, you can pass them on to students that day. We recommend, as you will see on our guides, to print them ahead of time with the student's name and the student's assessment ID, one on each page. Hand them to each student that day so they can look at it as they type it. It will be a 20-digit alphanumeric code. And once they're ready to enter this code, they will go to the login page. They will type in their assessment ID. They will then have to check the checkbox if the student has opted out of sexual health items. Now, we have already distributed sexual health opt-out letters, so these letters have been translated in various languages for your use, and we encourage you to hand these out to students, take them to their guardians, so that if the guardians wish that the student not take any sexual health items, not answer any of these items during the assessment, then they can sign the bottom portion of the letter and return it back. And you will then just have to make sure that the student selects this option. If they select this option, then SurveyGizmo will not route any sexual health items to them. So this will be the responsibility of the health assessment proctor on the day of the assessment to ensure that all the students that have returned these guardian opt-out letters select this option at the bottom. Once that's ready, then you can just select next, and then the student will be ready to move on and answer the first question. So here you have an example question. You have the back and next buttons. Now, if a student reaches all the way to the first question, let's say they go forward and hit next, then they want to go back and they are on this first question and select back again, they might be prompted to have to enter their assessment ID again. So that's just something to be aware of. But the students can move freely back and forth as they go through the assessment. Again, it's a very short assessment, 13 to 14 items, so it should not take the students too long to complete. Now, once they have completed all their questions, they will receive this, and then as you will note on the bottom, that says 100%, and that will track the students' progress as they move through the questions. If there's any errors in entering the ID, then obviously the ID has not been set up in the system, and just make sure that the student is entering the assessment ID correctly. So you might get something like this if this occurs. Now, if there's any more questions, please refer to the guidance documents that we have created. That includes the LEA guide for the 2016 Health and Physical Education Assessment and the Health Assessment Proctor script. We also encourage you to email us at aussie.schoolhealth@dc.gov if you have any questions or concerns. We are having this again as a learning year for everyone, so we would like your feedback as much as possible in the various aspects of the assessment. If you feel like there's something that we can work on for future years, we would really like to hear your feedback so that we can take this into consideration as we move forward. Again, thank you for taking the time to listen to this webinar, and please feel free to reach out with any questions.